There's a personal story to this. My mom, at her age of 30, I could see her gradually losing her memory, gradually losing all her daily functions. When I lost her, probably that's what drove me to become a neurosurgeon. Back pain is basically the second most common reason for any patient to visit a doctor. Sitting is the new smoking.
Yeah.
So it's getting there. So the ill effects that prolonged sitting can cause have been equated with the ill effects that smoking can cause.
They just come to you for a pain, and then you have seen something that remotely worse on the inside.
There was this elderly lady, 85-year-old lady.
Yeah.
Everybody would have thought it's just some sort of an age-related issue.
Yeah.
They came back to me 2 days later with an MRI that showed a spinal tumor. Once that happens, it's the point of no return. We did the surgery and she went back home the next day. 20 years is what it's taken me to reach where I am now.
Yeah.
Take care of your spine and your spine will take care of you.
Hi sir, good evening. How are you doing first off?
Good, great, Sharanya. Thank you very much. So, I really wanted to appreciate you for the effort that you're doing. I think you've been doing an amazing job, and I think it's the need of the hour, whatever you're doing now, and these kind of podcasts and this kind of information, I think, from doctors right out into the community, and so that patients can benefit out of this.
Yeah, I think thank you so much, because that was the entire idea behind starting this podcast. Because we didn't want it to be just a podcast that is just for the views. More so wanted to make it science backed, wherein we can actually give real solutions rather than just doing it for the views of it and the likes of it. So that means a lot coming from you.
No, really.
So Dr. Akshay, you are a neurosurgeon, but why neurosurgery? Like, what drove you towards neurosurgery?
Well, so yeah, it's been it's been a long while now. It's been almost 15 years.
Yeah.
So, but yeah, if you ask me why neurosurgery, I think I've always wanted to be a neurosurgeon. I mean, contrary to what you may think, or contrary to what it's always been there.
Yeah.
So a large part of it is because there's a personal story to this, where my mom. So she always wanted me to become a doctor. So medicine was always the first choice for me, right from my younger days. But at her age of 30, she was diagnosed with frontotemporal dementia.
Okay.
Yeah. So, and I had to see her going down day by day, right from in her early ages, where probably in the peak of her youth, where she had to suffer with this disease. And somewhere down the line, I could see her gradually losing her memory, gradually losing all her daily functions. And I lost her at an early age. So probably at the age of 40, 38, she was no more. So that's when it really drove me to take up neurosciences as something which I really wanted to make a difference. And probably that's what drove me to become a neurosurgeon. And why neurosurgery? Because I felt whatever said and done, medicine wise or medication wise, could not really bring about that change. That kind of, I felt I'm not doing anything substantial. The kind of work I'm able to do with surgery.
Right.
Surgery, I'm able to actually physically change the structure of a patient and bring about a functional difference in their life.
Yeah.
So any other kind of a surgery, you're just changing, structure. You're removing a part of a portion of a human body. But here in neurosurgery, I'm actually not just removing a certain part or just taking away a tumor, or it's actually bringing about a structure or a functional change in their daily life, and sort of relieving them of pain and suffering.
Right. I think that's so important that you said that you are connected to neurosurgery via a personal connect with your mother, right? Because neurosurgery is long hours. It is not like any other surgical specialty. For people who don't know what it is, neurosurgeons are there for trauma, they are there for stroke, they are there for any kind of thing that happens in the hospital, and they are the only ones, I think, who are on call apart from the gender medicine guys. Right? And
that's true. You're on call every day.
Every day. And it's long hours. It just doesn't end with a 12-hour shift. Sometimes it's 48, sometimes it's greater than that too.
Absolutely,
And
absolutely.
you hardly ever get to see the light of coming out of the hospital on most days. So what is that through all of this that kept you pushing and kept you moving through? And today you're here and you're a spine surgeon specialized in spine. And what made you move towards the spine?
So yeah, whatever you said is absolutely true. As a resident, so once you made up the decision of becoming a neurosurgeon, there's
Yeah.
no going back. So my training was for 6 years in neurosurgery. I took up a direct neurosurgery training program.
Right.
Those days it was there. I mean, it was one of the first few courses where you could do a direct neurosurgery. Now there are many more options. It was not an MCH; it was a DNB degree. So, but then again, I wanted to make the difference. Once I took that, many people those days there were people who drop out, especially because of the various reasons you already mentioned, long hours, long shifts. It can definitely drain one, one's spirit also. So, but yeah, I mean, I knew I wanted to be a neurosurgeon, and there's no going back. It was
Right.
this or nothing else. So yeah, that kept pushing me to do those. And like you said, it's not just 48 hours. Sometimes it was 72 hour shifts. You're stuck in the hospital day in and day out, morning to evening, surgery, seeing patients outside. So there was a saying in neurosurgery: you do these certain things at any point of the time, regardless of the day or night. You sleep and eat whenever you get the time, because that's the only time you get. And yeah, so I kept pushing myself. Then before I knew it, 6 years was over. And during the course of my residency itself, I was lucky enough to train at a very good center where I was exposed to a lot of cutting edge work. And when I mean by cutting edge, I meant we were doing a lot of stuff which most other DNB neurosurgery centers were not doing. Minimally invasive neurosurgery, minimally invasive spine surgery. So somewhere down the line, I felt that I was doing more of. I was already exposed to a lot of spine, and I felt there you could significantly make a difference in a patient's life, where you're actually relieving the patient of one's pain. And sometimes that's what really brings you happiness. The outcomes, the safety profile with which we're able to do this kind of very, very high end work. And there you have it. I somehow I ended up tilting towards spine surgery, and here I am.
Hi, I'm Dr. Sharanya, a medical graduate and a certified physician with a master's in public health and also a master's in functional medicine and bioidentical hormonal replacement therapy. I have always believed that health is more than medicine. It's about resilience, mindset, and the human stories behind every journey. Welcome to Beyond Limits. This podcast brings you conversation with experts, change makers, and everyday people who have pushed boundaries in health, life, and science. From breaking barriers in medicine and science to redefining wellness and uncovering the untold stories of grit. Beyond Limits is about thinking bigger, living longer, and going beyond what people believe is possible. And if you'd like to work with me on a one-on-one or book a consultation with me, you can reach out via the link in the description at the email therealsharanya@gmail.com. It is THEREALSHARANYA@gmail.com. Let's go beyond limits together. So you're now in the best phase of your life in terms of neurosurgery, maybe a place where you dreamt of, and doing all the cutting edge surgeries and doing everything that you would have thought of as a postgraduate, right? Did you ever have a moment where you felt like this is not my thing and I need to move away from here?
So I don't think that ever crossed my mind, because like I told you, I always wanted to be a neurosurgeon, and I think I'm probably so-called living my dream right now, where I'm actually doing whatever I wanted to do, or where in terms of career wise, or in terms of what I actually wanted to achieve.
Right.
But yeah, I would say if there was ever one phase which actually, probably not just for me, for many people, I think it was during COVID, where there was a lot of question mark as to you never knew what was going to happen, in terms of hospitals. They had sort of cut down our salaries, and as a neurosurgeon, you never knew also, because it's all COVID everywhere. So didn't have any patients, didn't have anything else to do. Whatever was done also, there was a lot of fear among the people. So even surgeries, we had to take the utmost precaution, wearing that PPE kit with lead aprons, with no, sometimes no ACs, because in the operation theater we don't want to circulate, and especially operating on COVID positive patients,
Yeah.
emergencies. That was sometimes really, I think, probably the toughest phase in the recent past, apart from, if you say, exclude residency or whatever. But
Yeah.
I would say that was a time where you really had to question what are we doing? I mean,
Yeah.
what the hell is really going wrong? But it's not like it really questioned my my field as neurosurgery, but it questioned our entire what are we doing as doctors as a
Yeah.
whole.
I think that was a testing time for everybody because it just felt uncertain. We
Yeah.
did not know what was the wake of tomorrow. Because even at the hospital, I think most of us were just trying to do the basics to keep the patient alive because we didn't have anything else.
Absolutely.
So I think that was like a time where most of us thought what is happening because we didn't know what to do even.
Absolutely.
So, and you've also trained in Amsterdam, if I'm not wrong,
Correct,
in the
correct,
Netherlands,
correct.
and you've also trained in the US.
Yes.
And many other countries, I think even Australia as well. How was your experience training in India versus training in outside Indian countries?
So that's a good point. So now I went to Netherlands as a medical student, actually. So back when I was in my internship, just as one of the it was a summer school kind of a program, once again in neurosurgery itself.
Right.
So I even back then I knew I wanted to take up neurosurgery. So that was a 1 month kind of a course which I had just gone. It was it was really an eye opener as to, because it was people from all different parts of the world. It was not just me. So medical students from various parts of the world. So I had a chance to interact not just with the European sort of experience or Netherlands experience, people from China, people from Russia, people from South America, people from UK, as well as people from other third world countries also, many from Africa, many from Southeast Asia. They all come down there, and it was a very good exchange of ideas, culture. So that was a very different experience for me, apart from being experienced in neurosurgery. So that's where I even got the whole. I mean, they were one of the few centers. I went to the University of Groningen. So very few centers back then itself who were doing cutting edge work for neurosurgery in terms of functional neurosurgery and things like that. So that was my first experience going outside India for training with neurosurgery. But then again, so that was just a very preliminary kind of an experience. So after I joined neurosurgery, so I mean, even before that, I'd gone to, as an even at the second trip I'd gone, I was first to the US. I was initially thinking of doing my USMLE, going and settling down there. So I had gone there to give my step to CS, and I got the opportunity to train at Harvard.
Wow.
So Harvard and Mass General, again as an exchange program, as an externship, I'd gone there. So as a medical student, if you go there, you can actually scrub. You're not just an observer. So actually, I got to scrub up with most of the cases over there. I saw a lot of minimally invasive neurosurgery, even over there itself. So pituitaries, endoscopic surgeries. So a lot of things were there which were really very new to me as a medical student. So then I came back. I was really decided, okay, this is something I really want to do. And I started preparing for exams, and I got into my neurosurgery as well. After getting into neurosurgery, I realized that like I told you, I was lucky enough to get into a center where they were also doing really state of the art work. So a lot of things which were being done, say 10 years back over there, was slowly being incorporated in India as well. Most of the corporate hospitals, luckily in Bangalore, I think, are already investing heavily into equipment, technology, so that now I feel that difference is not there. So then again, as a neurosurgeon in my residency, I went again to the US, did again an exchange program over there for a sort of like a fellowship. It was a grant. I got a scholarship from the US. I mean, the Asian Association of Neuro. It was basically the South Asian American Association of South Asian Neurosurgeons. So I got a scholarship through that, and once again I was able to train with very senior faculty in San Francisco. And lot of, again, I was doing a lot of minimal invasive spine. He was chair of the group chair of the CNS and AANS, that is Congress of Neurological Surgeons and American Association of Neurosurgeons
Hmm.
joint chair of spine.
Yeah.
So I got to train with him. So once again, my exposure to spine, that's where I really felt that he was probably a very good mentor, and we actually established a mentorship with him.
Right.
So with him also I was able to get this kind of an ongoing discussion, an ongoing rapport, and probably even like a mentorship kind of a program. We could discuss stuff. So even now, I mean, he's just one email away. His name was Dr. Praveen Mumanini. So I trained with him. So that was my sort of second experience in the US itself. Then I came back. Once I finished my neurosurgery, I was once again lucky enough to go to Australia. So there I did a dedicated spine fellowship program. So it was a 1 year kind of a program where once again they were doing a lot of advanced robotic work in and deformities, as well as minimally invasive spine work in Australia. So these all, I think these are the things which sort of shaped me into what I am today. And I realized that today, if you see, we're not so far. I think if you see, compared to where India is standing today in terms of big cities like this, metros, where people or hospitals are actually investing into heavily into technology, techniques, I think we're getting there. But the difference, if you ask me, is that these are developed nations where money is not a problem. So insurance covers everything for the patient. So patients really need not worry about getting a surgery done, or kind of, or even hospitals need not worry about kind of investing in equipment, because most of the places insurance pays for it. Whether it was Australia, whether it was America, even Netherlands. So these are the kind of places where there's global or universal health coverage. So nobody, neither the patient nor the doctor, need to worry about what kind of, how expensive a treatment is. Here, that is definitely there.
I think so. Like you rightly said, in India, cost is a huge factor in patients deciding what kind of treatment they want. And also, I think now slowly insurance is catching up, but may take some time, but it is slowly catching up wherein we're getting different insurance policies now. But like you rightly said, we are today, I think, at the most cutting edge as the world can be, because technology is available, investors are available, but I think we're just stuck at the last wheel, that is the patients being able to fund it.
Absolutely.
Right. So you, every time you hear brain surgery, some people think it's the most complex thing, and I know it is the complex thing, and people think it is terrifying. They ask, can we walk after surgery? Can we talk after surgery? And what is it actually? What does a typical brain surgery involve?
So,
or a spine, if I were to say specifically?
No, absolutely, you're true. Whether it is brain or spine, so neurosurgery is definitely one of the, you're definitely, you're handling the brain or the spine of the patient. There is definite fear among the people. People nowadays would not think twice to get a heart surgery done or anything else, because it's life or death in those kind of situations. But this is something else completely. Function. We're just dealing with patient's function, how the patient may behave after surgery, whether they may get paralyzed, whether they may get, whether they may be able to talk or walk after surgery. But I think that is where the difference is. So definitely in the past, technology was not there. The techniques were not so refined, where there was, outcomes in terms of neurosurgery was not there. I think that's where the field of neurosurgery itself has got sort of a bad name, where, people still have that fear that, if I don't want to do any surgeries on the brain or spine, I know I might never walk again, or I might get paralyzed. I think that fear is still there among the people. But with, like I said, with advancements in technology and technique, I think we're getting there. Nowadays, none of my patients stay in the hospital more than 3 days, at least when it comes to spine. Even if it's a brain surgery in our team, most of the patients don't, if it's an elective planned surgery, we have the equipment, we have the advancement of in terms of technique and technology, where we can discharge patients with the same or better outcomes than what they came with.
Right.
We are relieving them of their suffering, whether it's a tumor that needs to be removed, whether it's a slip disc that needs to be operated. We are treating the patient's pain and suffering. They are able to get back to normal life.
Right. So what is one of those cases that you saw, that you remember, and it's like changed the way you think about your position as a doctor? And
so I think there comes a time in everybody's life where, as a surgeon, when you start, you feel that you don't know anything. then there's a time this is a phase in anybody's learning curve. Then you start doing cases, you initially you make mistakes,
Yeah.
initially you may go slow, you may be very fearful, you may be underconfident, but then as you do surgeries more and more, you gain confidence. There might be a time when the confidence becomes a little bit too much. Sometimes it may become overconfident. You may think that you can do everything, but then it's just sometimes one complication or one sort of a problem that patient develops,
Yeah.
where you sort of start questioning yourself, okay, am I really doing it? Then you start becoming cautious again. So probably if you had to ask me one particular thing which after I became a
Yeah.
consultant in my independent practice, it's where the patient came in for a simple surgery and touchwood walked back home, but during surgery there was a complication. Patient, there was a nerve injury. It shouldn't happen. It never happens, but somehow on that day it happened. So I was really afraid. What will whether the patient will get up and
Yeah.
walk, or whether the patient will have a problem, neurological issue. So, but then it was rectified during surgery, but then that feeling that it should not have happened,
Yeah.
that's always there in your mind. And this was sort of somewhere there in the beginning of my career as a consultant. So luckily patient improved after surgery, but there was a time where patient did have a little bit of weakness after surgery.
Yeah.
So that sort of makes you question whether what you're doing, is it right or is it wrong. Sometimes you should not be overconfident, and that's where you realize that you are a human being after all, and you can make mistakes.
I think that's a very important point that you said, that people take for granted sometimes and see doctors as gods. And then that's where the conflict arises, mostly because they think that we will be able to solve everything for them, right? And I think it's very important to understand that there is a human factor in it. And that is the reason we are able to do the things that we are. Because if it was a robotic thing, maybe it would have abandoned the surgery saying that nerve damage and we cannot do anything, right? At this nascent stage of robotics. But with all that being said, you have time and again mentioned that we are giving functionality back to the patients in spine surgery. What do you mean by functionality? Because I know that you see a lot of cases, whether be it scoliosis and spine deformities. Can you take me through some of those?
Yeah, so what I mean by that is, see, patient comes to you with a problem. The most common problem is pain. Pain is can be sometimes disabling. So patient is unable to do their day-to-day activities. What in terms when I say that, I mean in terms of their daily activities, so that is function. They're unable to function at a level which they normally would, because of either pain or a disability, because of weakness or numbness. So many times, when we're dealing with the brain and the spine, we are dealing with human function, bodily function. So that is important, whether it is the brain or the spine. All your actions, everything that you do is connected through that. Whether you're moving your hand, whether you're moving your leg, everything is connected through the brain and the spine and the nerves. So if the patient is having a problem, whether it's a brain tumor or a stroke, so this is when you deal with the brain. Or if it is in the spine, whether there's a spinal tumor or there is a simple disc prolapse which is causing nerve compression, they are unable to function at a level which they normally would. So when we do surgery and relieve them of their disability or of their pain, we are actually getting them to a functional level which is better than what they were earlier, when they had the disease.
I think that's important, like you said, right? Even pain is something that disables a person, and it's so important because we take it so lightly, right? What are some of the things that you see in your daily practice that people have ignored? Because our body gives us signs and signals that something is going wrong and you need to take care, and then they land up in your OPD with major symptoms.
Correct. No, I perfectly agree with you. I think you've touched upon the right spot there. When it comes to any other part of the body, you may not be able to ignore it so much as you would ignore your spine. So if it's a heart problem, you can't ignore it. It's going to give you a problem immediately. If it's a stomach problem, once again you can't, there's an abdominal problem, you just can't ignore those symptoms. whether it's cancer, you obviously know that the problem is there.
Yeah.
Unless obviously many times even there in because of lack of knowledge, lack of awareness, people do come to most of the doctors at a very last, very late
Later
stage.
stages, yes.
But I would say one of the most abused parts of the entire body is the spine. People just abuse it because they think that they don't just take care of it, but the fact is that is also an important part of your body.
Yeah.
And it is what is keeping you upright every day.
Yeah.
And but we don't know how to handle it. I think most people, the most important thing is lack of awareness of how to treat your spine well.
Yeah.
So I think that's the biggest drawback when it comes to the spine. So most people neglect it, whether it's a pain, whether it is your posture, whether it's your lifestyle, whether it's an exercise, simple daily exercise habit, or maybe a simple stretch. So these are the kind of things which I think once it gets accumulated, it's a cumulative problem that develops. So even if a simple degeneration, everybody's spine will degenerate over time. But if you don't take care of it well, if you neglect, it degenerates faster, and you'll end up with a surgery much earlier than you would have to otherwise.
So, like you were telling me that the spine degenerates, right? So I know why the spine degenerates, but then there are so many people telling so many things as to why the spine is degenerating. But according to you, what is that thing that we do most commonly in our daily life that's actually degenerating our spine?
I think it's nowadays, if you ask me, today's problem, it is lifestyle. So sedentary lifestyle. See, most of the, I think, present generation, at least earlier generation, they would be, there was no technology back then. So everything you had to, you didn't have the access to, a doorstep delivery, or, even if you had to go out and get stuff. But now everything is there at your fingertips, whether you want access to the internet, whether you want access to even simple grocery. I think it's in minute delivery, things like that. We are in that phase of the present generation now. So the lifestyle is completely changed. Now you don't even walk 5 minutes to go and get something which you'd rather just save that 5 minutes by taking your car or your bike or something like that. But that is where the problem is. So we don't walk that often, we don't exercise that often. So I think that's the problem that is happening, that is leading to an early degeneration will happen even if you have the most healthiest activist lifestyle. You will end up with degeneration. Aging is something which we have not reversed yet in according to today's technology. So the similar thing will happen. Your disc will degenerate, your bones will get weaker with age. That's not something that you can control. But what you can control is the disability because of a degeneration if you have a healthy lifestyle.
I think that's very rightly said, because in today's generation, whichever doctor I speak to, I think all of them really put a lot of emphasis on lifestyle, because I think today that's what we are missing. And maybe even 1% of the population don't realize that they're doing this to themselves. Because like you said, right, what you do in your 20s is not visible in your 20s, but you see that only in your late 40s.
Absolutely.
Right? So I think today, like you were saying, Dr. Akshay, that the major thing is to take care of it before it degenerates and to prevent it from degenerating at a faster pace. But if you were to say that apart from this, now we're all doing desktops, what are some simple things these people can do in a day that doesn't require them to take up, a 1 hour gym class or something?
Okay, so that whatever you said is absolutely true. Not to say that exercise is not important. You should dedicate in 24 hours at least maybe half an hour or 1 hour to dedicated exercise. But yes, people have work. I think nowadays the work-life balance is getting shifted. People are tending to work more, especially long hours, desk sitting job. The simplest thing is getting up after half an hour, 45 minutes, change of posture. The worst thing that happens to you or accelerates degeneration is sitting in the same posture for long hours. So I think the simplest thing that one can do is just getting up, walking around, come back and sit down. This is what I tell everybody. Even while you're sitting, you can do some sort of sitting exercises, breathing exercises, which sort of strengthens your core muscles, extensor muscles, abdominal muscles. So all this would definitely help in protecting your spine and preventing that degeneration, or preventing that the damage from getting accumulated over a long time.
Yeah, I think that's very rightly said. Now, considering all of this is done, and they take care of all of this, but we still see that the rising trend of spine disorders in India, it's constantly rising. And what are the most common disorders you see in your clinic?
So I would say the most commonest, in fact, it is absolutely true. the back pain is basically the second most common reason for any patient to visit a doctor, second only to the common cold.
Right.
All right. Nowadays, even common cold, people take treatment on over the counter. I think back pain is soon going to become the number one reason for anybody to come to the hospital. In fact, it is the number 5 reason for any work related leave or absence from work for majority of the population now. So it's so common, it's becoming. And I think back pain is definitely one of the most commonest symptoms that I see. Various reasons for that. It could be a slip disc, it could be a degeneration, it could just be lack of muscle strength leading to back pain, maybe muscle spasm. Somebody has done something, even if you try to do exercise the wrong way, you might end up with a complication, you might end up with a muscle tear or something like that. So I think that is definitely the number one reason.
Now that you said back pain and then you said disc bulge, what is actually a disc bulge?
So the disc is basically a cushion-like structure that is there between the two vertebral bodies, right? So now that gets degenerated. It's supposed to have maintain that hydration. It's supposed to be hydrated all the time, but then over a period of time with aging, that hydration gets lost, it gets dehydrated. When that happens, it's not behaving like a cushion anymore. So that's the time when it starts, it can bulge out. When it bulges out, it can occasionally press on the nerve. And when it starts pressing on the spinal nerves, that's when you get symptoms like pain coming from the neck to the hand or from the back to the leg. That's sciatica. So the number 2 reason is sciatica. So, and that can be a red flag, that can be serious sometimes. Back pain, even if ignored, can be many times harmless, but pain coming down the leg like a sciatica, if ignored, can definitely lead to a serious complication.
Right. And like you said, it can lead to a serious complication, but most people try to manage it conservatively, either by just going and taking a over the counter painkiller, or just by saying that it's just pain, I will rest and then go back. But instead of that, what would you wish they actually did?
I think all of them should definitely not neglect that. Okay, there's no harm in taking over the counter drug, but if any pain does not settle more than a week, I think it's definitely, that should not be neglected. We have, at many times, we have actually diagnosed various conditions incidentally just by doing an MRI or just by doing an X-ray. Many times we have found out conditions which, if it detected early, can be prevented. Sometimes surgery can be prevented. So just by exercise, they can maintain or prevent that accelerated degeneration from taking place in the long run. So I think that's what I wish most people would do.
I think that's very rightly said. I think just consult your doctor rather than trying 500 things that may not help you. Just seek that help, because we're in a country where that is the most easiest thing to do. And now we have online consultations and so much more, right? Now, coming to the fact of you also deal with a lot of spine deformities, right? How does that actually set in, and who are these patients? Why do they land up with a deformity in the spine?
So deformity is a very, very vast topic actually. So deformity is basically various types are there. So we have congenital deformities, means the birth related deformities, right from the day the child is born, they're born with an abnormal development, so that leads to a deformity. Then adolescent idiopathic deformities, where there's no cause, so it just happens, and that happens during the growth phase. So that's an adolescent idiopathic kind of scoliosis that we call. That's actually the most common type of deformity that spine surgeons treat in terms of deformity requiring surgery. Then of course there are various other conditions, genetic, neuromuscular conditions. So these are the sort of rarer deformities. But then again, the next common deformity is adult or degenerative deformities. Degenerative scoliosis, listhesis. This leads to spinal deformities, and then that can actually be debilitating in terms of pain and weakness or numbness, that causing nerve damage. I think that's something which should not be neglected.
Right. Are we heading towards, like you were saying, towards an epidemic of spine disorders in India?
I think it's getting there. World over, that's happening, and India is not going to be left out of the race. So there is a saying now actually. So sitting is the new smoking. So it's getting there. So the ill effects that prolonged sitting can cause have been equated with the ill effects that smoking can cause.
Right.
So I mean, of course, sitting is not going to cause cancer, but in terms of degeneration, in terms of lifestyle disorders, whether it's diabetes, hypertension, these kind of non-communicable diseases, sitting, or in terms, when I say sitting, I mean sedentary lifestyle.
Yeah.
That's what it causes. And spinal disorders are also caused because
Hmm.
of prolonged sitting.
Right. I think you have rightly said, because sitting, unlike other mammals who have evolved to utilize their spine as per their daily requirements, somehow we as humans have not evolved, and we may not agree, maybe we may not feel it mostly, to say that our head is actually a very heavy structure
Absolutely.
that is sitting on a very delicate
Spine.
structure, that is the spine, right?
Yeah.
And most people don't realize it, but a lot of problems start maybe with the posture of their head, which moves to the posture of their neck and then shoulders, which eventually trickles down to the lower spine. So what are some of the things that they should actually look at in terms of getting these things right, or be aware of these things?
Correct, absolutely. And I think you again hit the right note. So as humans, we have evolved to become erect. That's what separates us from the rest of the animals, the rest of any other mammal. So being erect actually has taken years of evolution.
Yeah.
And now we're just abusing that and going and sort of putting all those years of evolution down the drain. Just because we don't know, or just because we are maybe in the future, I don't know what the future holds, where we may evolve into becoming something else.
Yeah.
Because of technology or because of this one. But today it's not there yet, and we are actually harming ourselves more. Posture, another important point that you said, is posture. So sitting in the correct posture also matters. So we shouldn't slouch. There are various ergonomic postural where they say that how you should sit, how you should stand. So there are certain things, like even if you're sitting in front of a desk, you should make sure that your arms and the legs are all actually 90 degrees. All your joints are at 90 degrees. It should not be too high or too low. Even the screen should be at your eye level. These are the certain things which ergonomic. I think that is something which we need to understand and we need to be aware of.
Right. I think it's very important because, like you said, right, we are actually wasting our evolution into the sedentary lifestyle, because today most of the problems we see, mostly spine, everything is related to our lifestyle, like you were saying. But you deal with such a delicate organ, I would say, or such a delicate structure, which is the spine, which basically once disappeared, there is no life in
Absolutely.
the human body, right? It's almost like, you see in Avatar or anything, right? They have this highlighted part on their back, and there's like current passing through it from one organism to the other.
Absolutely.
How does it feel for you to be responsible in that facet? So when you're opening up a person.
Absolutely, you're absolutely right. It's a huge responsibility. That's what most patients ask. Now, how can you tell me, how can you guarantee that I'm not going to be paralyzed after surgery, or you're dealing with the most important structure that I want to walk, I need to walk. I just tell them one thing. Yes, of course, that's what all my years of learning and all my years of whatever you have learned so far is to do no harm first.
Yeah.
So that is very important. So whenever we do surgery, there's an extreme level of skill, extreme level of, in fact, even stress involved. But then that becomes sort of second nature when you keep doing more and more with more of experience that you've gained. So it's very important that you have to take care of that delicate structure and make sure that you don't do harm first.
Right. I think that's very rightly said, that we don't do harm first, because at the end of the day, patient has to go back with functionality, like you have always mentioned. But with that being said, is there a sense of what is the sense that you have the minute you hold your scalpel and then you're ready to go into the surgery in the OT, and what does that feel like?
No, I think it's very right. I think I already mentioned it earlier also. Sometimes you realize that you have to be down to earth.
Yeah.
So my first thing that what I've learned is that you are not God. You cannot do everything. You can only do what is possible in your hands, and whatever God has given you is what your skill is, and that's what you are today.
Yeah.
So even it's my usual routine or usual ritual that I do every time before I even scrub up for a case, or as I'm scrubbing up, is a prayer.
Yeah.
I just pray that everything should go well. I pray to whatever you may be religious, you may be irreligious, but there is always a force that is beyond you.
Yeah.
There is something that is beyond your knowledge, or something that is beyond your control. You pray to that force and you think that everything should go well for that patient on
Yeah.
that particular day.
Yeah, I think it's very rightly said, because there is a force guiding us, and it is an energy or whatever anybody may say. But I think it's important, like you said, every surgeon has their own way of prepping for a surgery, and it's very important that the patient is safe at the end of the day.
Absolutely.
So recently you've gotten a AO spine research grant using ultrasound to reduce radiation. What was the outcome and why does it actually matter?
Correct. So that was a very, I mean, I feel it was actually during my residency which I actually did that. So I mentioned to you that we're doing a lot of minimally invasive work
Yeah.
and stuff like that. So that is definitely new as compared to, I mean, for in terms of spine and in terms
Yeah.
of surgeries, in terms of techniques. But there is the biggest disadvantage, because you're not seeing anything, right? You're not cutting open the spine, you're not having any anatomical visualization or any landmarks there. So everything has to be done based on X-rays. So that's a huge radiation. And I think in the early stage of development of minimally invasive surgery, a lot of doctors were exposed to extensive radiation.
Right.
I mean, of course, the patient also is getting exposed to radiation, but that is
It's
only for
one
one
side.
patient.
Yeah.
But this, as doctors, we are getting exposed on a daily basis for numerous cases. So there's a big I mean, I would say challenge in terms of the spine community, how to reduce this radiation to the minimal possible, so that because you can't do spine surgery MI or minimal invasive spine surgery without radiation. It is there's nothing there. So how there are if and the whole idea of that the study was to find out if there could be an alternative technology wherein you can use that to real time, I mean during surgery, because you can't do an MRI every time. MRI doesn't have radiation. So an ultrasound is definitely just using sound waves, and there's no radiation. So that was my concept. It was a proof of concept kind of a study where we actually tried to see if we can do spine surgery using ultrasound. But I feel it definitely, we had some results, but we don't have the technology there yet.
Right.
So the available technology today cannot allow you to do spine surgery as efficiently as with radiation, with ultrasound. But I think with development of technology, ultrasound is definitely a very good tool to be able to do spine surgery minimally invasively without opening up, and so that you're able to see the structures in the ultrasound imaging, so that you can do spine surgery as well.
I think that's important because I know that a lot of radiologists, a lot of cardiologists and spine surgeons, all of them have this problem that even after wearing the lead apron, even after all of that, still the radiation is at a very high level for a doctor.
Absolutely.
Like, in fact, radiologists have these badges wherein they have to step out and things like that. And even spine surgeons, I'm sure. Right? So I think this is great because I think it gives us hope into new frontiers for doctors, because at the outset, most of us are really worried about patient health.
Absolutely.
This really opens up something for the benefit of doctors.
Correct.
Now, that being said, what is some of the research and innovation that's currently going on in neurosurgery?
So I would say in medicine as a whole, neurosurgery is at the forefront of leading innovation in terms of research, because that is still an unexplored frontier, or it is it's a newer field. It's a relatively nascent field if you take the whole of medicine or the medical specialties, if you consider. So there's still so much to discover in terms of improving patient outcomes. One of them is minimal invasive technologies and techniques. Now the next thing is how technology can, we know that we can do something minimally invasive, but how can technology help us achieve what we have by reducing risk to both patient as well as the surgeon.
Right.
So that being said, there are a lot of technologies nowadays. One of them is neuro-navigation. So that is something which has definitely helped us achieve using patients images like CT or an MRI, which was taken before, and you can merge it with the patient's anatomy during surgery, so that you can achieve where you can deliver better outcomes to the patient. You can delineate tumors, you can identify where the tumor is even before you open the skull of a patient. or similarly you can identify where the disc is or where the bone is even before opening up the patient. So that helps us achieve minimal invasive spine surgery or minimal invasive brain surgery. That is one thing. This another thing is neuro-monitoring. So like I said, functional outcome is extremely important for us in neurosurgery. You need to know everything has to work at the end of surgery. So something called neuro-monitoring is what we utilize. So we connect the electrodes to various parts of the patient, the nerves, and we actually monitor that in now we connect that to a computer, and these impulses are actually recorded. So in real time whether the nerve is working or not, how the nerve is behaving, so that if at all you're touching some part of the brain or spine which is or some nerve which is affecting, and you can instantly find out whether that step, whatever you have performed, is affecting the patient in a better way or in a worse way.
Right.
Sometimes, many times we have seen during surgeries where initially the nerve impulses were not there. Also, then you don't know what has gone wrong. But sometimes you do a surgery and you take out a tumor, or you remove surgery, you remove the compression on the nerve, you see that impulse coming back. I think that is some of the most it's really relieving as a surgeon. You see that okay, some impulse which was not there is come now. It's really beneficial. The patient will walk, even if the patient is not being able to get that immediately after surgery. That it's working. So then for a fact that it will definitely work in future.
I think that's a great feedback as a surgeon also. Like you were saying, it's like a huge satisfactory relief, I think, to see that an impulse which was absent is now active.
Correct. Absolutely. Yeah.
What are the other things that are going on now in terms of robotics and
Correct.
minimally invasive? Because I think that field has expanded massively,
Correct.
right?
Correct. So robotics in neurosurgery is once again very, very new. It's already there in terms of gastrointestinal surgery, cardiac surgery, where the robot has really advanced, where you don't even have to be humanly present inside the operation theater. Most of those robots are or many times operated remotely.
Yes.
So surgeon can stand elsewhere, be in outside the operation theater, where of course these are all still cobots, we call that. They're not robotic in terms of like an independent robot, what is automated in terms of machines that we see. But since you're operating on a human body, so we haven't reached that level of automation yet, like you see in the sci-fi films or whatever. But the robot is still a cobot. Is performing surgery which is done by a human in externally. So that is where the robotics has already advanced in terms of general surgery. But in neurosurgery we are not there yet. So because we have to still, the robot is still just an assistant. So it can, in terms of spine surgery, robotics have actually advanced to a level where a robotic arm can guide you to a pre-planned trajectory. For example, you need to place a screw inside a bone at a particular trajectory. Now, earlier you would have to do it manually. So if it's one screw, it's okay. But sometimes when you have to place 10 screws, it can be laborious. And it can be, so a robot basically can make sure that what you have planned pre-operatively or what you have planned before, the robot will definitely 100% achieve that plan or that planned trajectory. So for sure accuracy is 100%. For sure that safety is also not compromised. Because what you plan is what it will do. Of course, if you plan wrong, it will give you a wrong trajectory. So that is where the human involvement is still there. Because a robot only can do what you intend it to do.
Right. I think that's very rightly said, because it solves the fear of many that AI may take over, robotics may take over, but it's always that first you need to have agency, and only then the robot can work.
Absolutely.
I think that's an absolute truth that I was having a discussion with a couple other friends, and they were like, either if you do not have agency, then the robot is useless.
Absolutely. Yeah, it can't do anything independently. And I think it's a good thing. You need to have control. So God knows in the future what robotics can achieve. Maybe it may be able to do something at the press of a button. You press this button, it may actually be able to do. That's with machine learning and AI. It's definitely possible. If you ask me, is it possible in the future? It is 100% possible. So many things are getting automated. Certain steps of surgery may also get automated. It already is getting automated with this. If I want to place 10 screws, I just press one button. It will tell me it will move from one screw. After placing, it will go to the next screw, whatever I need to place, and it will give me that trajectory. Tomorrow, it may be able to do that also.
Can you break it down for me as to how it's actually giving you the trajectory? Because the spine, you're already open and then it's moving, because I think most people won't be able to visualize what you're actually
So I
saying.
mean, you probably need an animation, or you
Yeah.
probably need to see a video for this. But let me just break it down.
Yeah.
So you have a CT of a patient.
Yeah.
Pre-operatively, that's already taken, or even during surgery, we have nowadays intraoperative imaging. That's
Yeah.
another new technology which is already gained. That is neuroimaging during surgery. You can have an MRI or a CT of the patient that's been taken in the surgery.
Right.
Because sometimes in spine, if you're lying down in an MRI or a CT, you're lying down, supine. You're lying down with your face up. Whereas in surgery, you're actually lying down face down. So these are technologies which are sort of helping you. There's certain even in robotics, that's where it sort of takes that to the next level with AI and with machine learning, where even if you have taken an image which was in a different position, you just by taking an X-ray shot of the patient during surgery, it will merge that X-ray to the pre-operative and give you an image which is quite very real time.
Yeah.
So what the robot does, you have this image. So a good image is very important. So that is that's a very important prerequisite to have a good image of the patient's structure.
Yeah.
So now you plan a particular screw, whichever way you want it to, so that it is safe and it is going only in the bone, it's not touching any nerve.
Right.
You plan that for various levels. If you need it, for example, L4 or L5 or L3, whatever, you can plan it in the patient, in the robotic screen itself. So you do that, and once everything is done, once your patient is whether you're doing a minimal invasive surgery or an open surgery, does not matter. That trajectory, if you just press on the screen, the robotic arm, the robot is basically still just an arm. It's nothing else. It's just an arm with a tool, wherein it's basically giving you a space to put the screwdriver and place the screw inside the patient. So that arm moves from one position to the next position, which is already planned.
Yeah.
So that's how the screw is placed robotically. But you're still placing the screw.
Yeah. But it is just planning the trajectory.
Yeah.
As someone, I don't know if you've watched sci-fi movies.
I watch a lot of sci-fi movies.
Does this feel like Transformers in your OT? And then does that excite you?
Yeah, I think so. I mean, like I said, I am part of the generation which is, has always been into sci-fi. Right from my younger days, we've always watched sci-fi cartoons. Nowadays, with newer technology, they're able to give those kind of real life images in Hollywood movies. And so I feel that's probably one of the reasons where I feel we can achieve something.
Yeah.
Whether it is robotics, and I feel the younger generation are at a greater, are more adaptable to use this technology.
Yeah.
So that you can probably grow with it.
Yeah.
The technology grows with you as well.
Yeah.
So you can give feedback as a surgeon. I think our present generation, we can give feedback to the manufacturers or to the industry, where we can tell them what we want. And I think that day is not too far where sci-fi becomes reality.
I think so too, with how we're advancing in technology and with everything that we're seeing happen, I think it's not too far away.
Yeah, absolutely.
But it's only about how fast we adapt as a generation to it.
Correct.
That being said, are we moving towards totally non-invasive surgery in the next 10-15 years?
Maybe, I guess. So we've seen more and more less and less invasive, I would say. So more and more surgeries are performed with lesser damage to the patient.
Right.
So it may have started with an open surgery where everything was just open, even for maybe a small surgery, because you need to see the structure.
Yeah.
That's how our study, or that's how we have learned. We see, even right from our anatomy days, we open up everything and study the structure of the human body.
Yeah.
It's by opening. But then again, you have non-invasive method of imaging. That's where MRI and CT scans have had revolutionized, with the development of X-rays and how that was applied in medicine. Without opening up, you can actually see inside.
Yeah.
That's how I think the evolution of medicine has taken place.
Right.
So with technology aiding us, we are now able to achieve more and more of what you think, because our knowledge of the human structure is always there. You always know. You just have to apply it without having to open the structure.
Yeah.
So now you have extremely high quality MRIs. With that, what structure is where. Of course, it's very individualized as well. You're not just applying a random knowledge of a general structure, human structure so this is very individualized information that we are getting.
Yeah.
And real time. So with that, I think more and more we can achieve minimal invasive procedures, less and less cutting. So that nowadays, even with spine, we had seen with mini open, wherein you just open the structures wherever is necessary. Then it came to tubular, where you just put a small tube. Then of course now endoscopic structures are there. So you've gone down from a 10 centimeter incision for a simple surgery to maybe a 5 centimeter incision. Now you've got a 2 centimeter incision. Now hardly less than, maybe a centimeter.
Yeah.
So we are able to achieve inside whatever we want to achieve just by reducing the skin incision.
Yeah, I think that's so important, like you're saying, because recovery times become faster, because the number of damages to the muscle fibers, to the skin, and everything is much less because you're just using a small incision rather than a 10
Correct,
centimeter.
correct.
So patients go back happier and they go
Absolutely.
back,
Absolutely.
smiling because their pain is reduced.
Correct. So that's exactly my thought process. My concept is that ultimately I want to achieve painless surgeries.
Yeah.
Where because your patient is coming to you for pain. You don't want to give them more pain.
Yeah.
So that is where I think the whole concept of minimally invasive surgery and things like that, or least invasive surgeries nowadays. So you can do the same surgery inside, everything is the same, whether it's a simple disc surgery or a complex spine surgery, whatever it is. You're doing the same amount of work that needs to be done to rectify the problem, but with less damage to, or less collateral damage to things that need not be damaged. With the muscle, you need the muscle for recovery. You need the muscle. If I damage that muscle which is going to help you in recovery, you're not going to be able to recover that effectively.
Yes, I think that's so rightly said. But now, having said that, do you have patients who come to you in a very bad state, or they do not know what is happening? They just come to you for a pain, and then you have seen something that's remotely worse on the inside.
Absolutely. I think it's very important. That's what we've discussed earlier also, where you should not neglect, and why I wish more and more patients come to the doctor consulting. So there was this recently, as recent as probably I think a month back. So there was this elderly lady, 85-year-old lady, who sort of she was been complaining of some back pain, generalized pain coming from the back to the front and radiating pain. Obviously everybody would have thought it's just some sort of an age related issue or something like that. So they came to me undiagnosed, and I said, okay, let's evaluate. Let's, she had already tried over the counter medications, even physiotherapy. These are educated people, right? So even though she was 85, she had, her children were all in IT, and so they were all from Bangalore. So they didn't want to neglect that. So they came to me for seeking a, expecting that, okay, maybe I'll just give some medications or telling them what they did was right.
Yeah.
And maybe some physiotherapy or something like that. I did suggest that, but I also just told them, let's just do an MRI. You are elderly, there could be various issues, maybe just a degeneration, maybe something else, maybe a nerve compression, maybe something, maybe I was thinking, maybe if I could give them an injection, it could help them, a nerve injection or something like that. This was going on in the back of my mind. I told them, just do an MRI to be on the safe side. We're not missing out anything. They came back to me 2 days later with an MRI that showed a spinal tumor.
Oh my God.
Yeah. So if left, the spinal, any tumor will grow over a period of time. Obviously it took such a long time for the spinal tumor to grow, but if left alone, it would have been growing, and it could have caused damage to the spinal cord, which could have led to paralysis.
Yeah.
Once that happens, it's a point of no return.
Yeah.
So I told them, obviously age was a factor, but then I told them, nowadays with advanced technology, you can do this kind of treatment, that needs to be removed. Otherwise you're landing up with paralysis if not. So they had to weigh the pros and cons. We had to weigh the risks versus the, benefits. I told them benefits are definitely there more than the risks.
Yeah.
So we did the surgery and she went back home the next day.
Yeah.
So even though complicated condition like a spinal tumor could be done through a minimal invasive surgery, and patient actually went back
I
home.
think that's so important. Like what you said was that even though she was 85, we took the call of doing, because now I think the conversation around health is changing. It is no more that, just because you're old, you don't deserve the surgery.
Absolutely.
Even for Parkinson's, now the conversation is changing that, even if you have 10, 15 years to live, and if that DBS is going to make sense for you to live a comfortable life, now people are getting it done, unlike the old mindset of,
letting it be.
I'm anyways old.
Yeah, because I think now people have realized the value of quality of life and the functional life. I mean, what
Right.
kind of, I don't want to be, most people nowadays, even if they want to be independent, they don't want
Yeah.
to be dependent on someone.
Yeah.
And that's where I think, we as doctors should try to help them.
Right.
Of course, we need to find that balance between risk versus
Right.
benefit. We should not do something too heroic, expecting that, patient, they're not going to run marathons
Yeah.
at that particular age. They just want to live their life independently, do their daily activities.
Yeah.
So sometimes we need to strike that balance of doing that, hitting that right spot, that sweet
Right.
spot of not doing too much, not doing too less, just doing what's right.
Right. I think that's so important because it's just in that balance that you find them to be beautifully enjoying their life. Nothing extreme or nothing less than that works, right? But that being said, you also go to a lot of outreach camps from the hospitals. You go to communities, you organize these camps and training and all of that. Why is that so crucial to what you do?
So, I mean, we are, as doctors, we have a responsibility not just to treat patients, not just to cure a disease.
Hmm.
I think as doctors, we all learn that prevention is better than cure. So awareness is about health is also equally important. And I think it's a moral responsibility, not just for me. I think most doctors, whether you're a neurosurgeon or anybody else, and more so in neurosurgery and spine surgery as well, because you can prevent most diseases, most spinal disorders because
Yeah.
of the right awareness, right? Maintenance of your healthy hygiene, healthy spinal hygiene is what I call it. Maintenance of a good lifestyle is very important.
Yeah.
So sometimes we go and conduct camps, obviously, to detect diseases which would have, if detected in the early stage, like sometimes we conduct scoliosis camps and things like that. So in children, in schools, we conduct that. So where we detect these kind of
Yeah.
diseases early on.
Yeah.
So if it is detected, it can, even if surgery needs to be done, we are not landing up with a very complicated surgery with
Yeah.
a lot of complications, and then having, to weigh those risks and benefits and deciding not to go for surgery because of the complications are more than the benefits. So at least if it's detected early, a simple surgery may be able to solve a problem which left untreated can lead to a very complicated issue.
Right. I think that's very rightly said, that just detecting a problem wherein you can prevent it from going into a surgery, or like you said, children with scoliosis. Scoliosis is again a spinal deformity which we spoke about, but it can cause so much more improvement in their life if just detected at the right time.
Absolutely, and you won't believe it. As recent as, I think, 2 days back, I had a patient who had operated for scoliosis 1 month ago. She came back. So she was a young girl. I mean, usually scoliosis affect these kind of adolescent idiopathic scoliosis. They affect girls more than boys, and it's more important in girls. They're conscious about how they look,
Yeah.
and especially as they grow towards that, 18, 6, after 17, 18,
Yeah.
you enter college and stuff
Yeah.
like that, so you're more conscious about your looks. So it's a cosmetic problem as well. And left untreated, if you have a bad deformity, even if the worst case scenario is not going to lead you, it's a mild deformity which is not going to have a neurological complication.
Yeah.
A lot of deformities in the early stage can cause neurological
Yeah.
problems, breathing problems, because of the lung and development of the heart
Yeah.
and stuff like that. And sometimes they may compress on the nerves. But even if that does not happen, the simplest thing that can happen is a cosmetic problem.
Yeah.
And for girls, I think it's very important to
Yeah.
look normal.
Yeah.
So this girl, she had come down and she actually had researched herself more than her parents, or she herself knew what scoliosis was. She knew what she was going through. So she found out, and she came all the way from Mysore. So they came all the way from Mysore to Bangalore looking for a good center where they do scoliosis work, and they actually came and met me. And her parents, her father, even till they told me that she found you. I didn't find you, but she found you, and she came to you looking for this problem.
Yeah.
And they were happy now.
Yeah.
Because she had a really bad deformity, and she was totally tilted to one side.
Yeah.
And that was her main concern, that she's her friends are making fun of her, or and she's not able to lead her daily activities. Even she was slouching, and everybody would just make fun.
Yeah.
And that's probably a big taboo here. I mean, in
Yeah.
India, if you're not normal,
Yeah.
you have a peer pressure, especially in that age, to be normal or to blend in.
Yeah.
So in such case, she came and we detected that she had a scoliosis. And especially if any scoliosis, if the curve of the spine or the deformity is more than a particular degree, like we say, the cutoff is usually 40 to 50 degrees. If it's more than that, surgery is definitely indicated.
Yeah.
Anything less sometimes can still be managed with, maybe corrective braces, or sometimes even exercise and physiotherapy. But more than 40, 50, it's unlikely to get back or
Yeah.
it's going to look bad as well.
Yeah.
So anything more than so she had almost an 80-degree curve. So we had to offer
Yeah.
surgery and told her that we might not be able to make you fully straight, but I may be able to correct this deformity to a reasonable level.
Yeah.
Even if it's not zero, at least if it is acceptable 10-20 degrees, it's still okay. At least your shoulders are balanced, your hips are balanced, you can wear clothes normally looking, at least you
Yeah.
look normal. So she came back after 1 month now and she was extremely happy.
Yeah.
So sometimes there is initial pain because of surgery and
Yeah.
all those things, especially in children, but then it's worth it. So
Yeah.
they're really happy. And she said, now I can go back to college. Nobody's gonna,
Yeah.
and I can
I
enter
think-
college with, a more confident
I think
person.
that's so important, because as we grow up, that affects each and everything, our mental well-being, physical well-being, the kind of relationships we make around us, whether be it friendships or relationships with peers and relatives, or how we're seen, right? Like you said, it's something that is so vital. And today, again, we're seeing a lot of youngsters taking health more seriously, I feel, whether be it for their parents or for themselves, wherein they do their research. And does that make you happy when patients come informed about their condition?
I think it's inevitable now. People
Yeah.
with technology, everybody internet is accessible to everybody. So everybody does their research and comes. Sometimes it's for the good, sometimes it's for the bad. Sometimes too much knowledge is also not good. You may
Right.
have you may this become the so-called Google doctors. You actually know more than what you think is necessary.
Yes.
And it sometimes makes it difficult for us to sort of make them unlearn what they've already learned through Google, and so tell them, no, that's not what it really is, and this is what it is. But it's okay. I mean, I think it comes with its own pluses, and sometimes it's easy to convince patients, sometimes that you have a problem if they already know, have a rough background about it.
Right. I think it's it's a double-edged sword.
Absolutely.
Both helpful and
Absolutely.
sometimes painful also for the
Absolutely.
doctors,
Absolutely.
to convince them that what they think is not right. But that being said, Dr. Akshay, you have such a busy lifestyle. Like, how do you maintain that work-life balance? Is it there, or work-life balance is just a fancy term?
So it's a very, very difficult question to answer, especially in our life. So in neurosurgery, most of the surgeries are quite long.
Yeah.
So unlike any other surgery, where even if it's a simple surgery, maybe it might get over in half an hour or something like that. But neurosurgeries tend to take a long time. You need to be extra careful. You need to be in that position. I mean, I keep giving advice to patients that posture is important. But sometimes we do surgeries for longer, standing, being in an odd posture, sometimes sitting with your hands up and things like that. So it can be draining. And because of our long surgeries and long working hours, that work-life balance does take a toll. And it's a constant fight I have with my wife as well. She tells me that you need to find that balance. And at some point, I think we need to also realize that you can't just keep working, as you all think. I think you also said it earlier. You can't just keep working for somebody else. You need to take care of your own health as well. So sometimes we need to reflect and sort of think and find that balance. So I make it a point now, at least once in a few months, you need to take that break. You need to take a vacation. You need to go out. You need to go out with family, spend time. You need to have that me time as well. So that's the thing, very important. I think it's most of the time we miss out on that.
I think that's very nicely put across. I think you've put it across in a very, very subtle way, right? But I don't think neurosurgeons are free at all.
No, it is
they
difficult,
are. It's a very, very difficult job. It's a very grueling job, and sometimes I feel it's also a thankless job, because at the end of the day, patients may be happy, may not be happy, but then we are there, with them, those 8-hour surgeries, 9-hour surgeries, or whatever, I think. But at the end of the day, I think patients also should understand that we are putting in the effort for them. And it is not that we have a magic wand that everything gets better, right? But having said that, you're also married to a doctor, right? Does that make it easier in some way, that it's easier to understand the language, it's easier to kind of cope with the stress?
I think I always found that beneficial. I find that we were batchmates. My wife, we were the same batch. So I knew her right from my MBBS days. So it never, for me particularly, it's not a problem. But I think it does matter if your spouse or partner is also a doctor. I think they can understand. And I think that matters. Because if it's somebody from a different field, they can never relate to you on that level, on a clinical level. Sometimes I can even discuss, or she can come and discuss a case with me.
Yeah.
I can relate to that, or I can discuss something complication which I had, which I felt. You can't just open up to anybody else, but if
Yeah.
they're already from the same field, you can actually open up. So that being said, I think in the US, on a lighter note, neurosurgeons have actually had the highest divorce rates and stuff like that.
Yeah.
Probably it's one of the main reasons,
Yeah.
work-life balance is not there.
Yeah, I think so, because I think you're always at the hospital. There is no time for you to actually go back and take that break and actually rewind, because it's just because surgeries are demanding, right? That being said, if there's a budding new medical student who wants to become a neurosurgeon, what's your advice? Would you tell them, yes, go for it, or take a step back, and what is it?
So I at this point, I would actually want to tell you something. When I was young, when I was in school,
Yeah.
so I was always intrigued by the human body. I took up science, I took up biology, because I was always, thinking that I want to become a doctor someday. But then, for a simple problem, when I used to go to doctors, or pediatrician or something, I tell them I want to be a doctor. They used to actually discourage, and they used to actually say that no, don't become a doctor.
Yeah.
Part of the reason is because I think that whole, there's so much of work involved, you so much of study, so
Yeah.
much of learning that's actually needed. So, sometimes you think, is it really worth it? I think so. A very important thing is dedication is really important. So I tell them, if somebody budding, somebody who's just finished MBBS, you're already done MBBS, so you're already down. You're already down that road. So you have to become something now.
Yeah.
Somebody who's not even taken up MBBS is a different thing. You
Yeah.
need to really tell them that, okay, you need to make them. It might be so glorified,
Yeah.
being a doctor, or you're, as you said, sometimes patients think you're next to God and things like that. But a lot of responsibility comes with that, and you just don't reach there.
Yeah.
A lot of effort is required, and you know that yourself.
Yeah.
So if somebody who is not an MBBS already, not even a medical student, wants to pursue medicine, I may say you really need to think about it. You need to be prepared for maybe the next couple of years of dedication.
Yeah.
Maybe 10 years. 10 years is easy. 5 years of medicine MBBS, then again 5 years of post graduation, 2 years, then super specialization, then fellowships. So it's a long road ahead. So although I finished my, I think probably 20 years back, we recently had our 20-year reunion, MBBS reunion. So 20 years is what it's taken me to reach where I am now.
Yeah.
Whereas if somebody else had done something other than medicine, they may have reached a different level of their practice or their career. Your career starts only at, maybe 35 or 40 in medicine.
Yeah.
But if it's neurosurgery specifically, I would tell them that, you need to be prepared for long hours. You need to be prepared for, 72-hour shifts. So it's something that you need to be ready for.
Yeah.
It's that dedication is involved, and that amount of precision and that amount of accuracy and the criticality of, what you're dealing with. You need to be able to give patients that consistently. You need to be able to give patients that outcome that is safe. Make sure they're able to do that. I think it takes a toll, and unless you have that bent of mind, it's not easy.
Yeah, I think that's a very, very great message, because it really tells them that it's not an easy field, because if it was easy, then we'd see more and more neurosurgeons,
Exactly.
right?
I agree.
And we see that today neurosurgeons are few, like literally you can count on your fingers, because the specialty is that demanding. And I think, like you rightly said, you need to be really prepared. You need to have that mindset. That being said, what is your go-to how do you handle all of this stress, and how do you keep yourself in a position to be able to deliver the best?
So I think maybe I'm not sure if it's a right message or a wrong message, which I might be saying now. Sometimes if you are too much attached or too much emotionally connected with whatever you're dealing with, you can't. You probably you may drain yourself, or you may go down that negative this one. So stress is there. You're working long hours anyway. So sometimes you just need to get disconnected. Once you're out of the hospital, probably you should not think. It's very difficult, because you're always connected with the patient. You may get a call in the middle of the night from the ICU that the patient is deteriorated or something like that. So as a neurosurgeon, you're 24 hours on call. But then again, wherever you get time, I think you should make the most out of it. If you get a free time, or if you get a day off, make the best use out of it.
Yeah, I think that's a very nice message to end the podcast with, that you get a day off, you make the most out of it, because that's the only time you have, right? And thank you so much, Dr. Akshay, for actually having this great conversation and making time, because it's
Sure,
really, really hard to get your time. I
no,
know
sure.
that. And
It's because you asked me for it, and I think I didn't want to, sort of. You've been behind me. You've been telling me give me that time, and I think I think I should do this as well.
yeah,
It's something that is beneficial for the community,
yeah.
and something that probably whatever limited knowledge or limited experience what I had, I could share with you and share with everybody else.
I think it's not limited, but I think it is limitless. And I think you're very humble for saying that you have a limited knowledge. But I'm sure, like, your patients benefit a lot from everything that you do for them on a day-to-day basis, whether being here or in different countries where you treat people across. And I think that's such an important message to take home today, that take care of your spines,
Absolutely,
because if your spine is not there, then I think you're bringing yourself up to a lot of issues which
absolutely,
may be unwarranted for in life.
absolutely.
And maybe this will give Dr. Akshay a break also to enjoy his life, because if we all took care of our spines, then we may have to see him less often, right?
No, but I think yeah, you're right. The message I think is very clear. You also said take care of your spine, and your spine will take care of you. Probably you don't need the spine surgeon.
Yeah,
But then yeah, there are that's where that message, you need the spine surgeon to give that message
yes,
to everybody as well.
yes,
So I think yeah, they ended it in a very appropriate message to the people as
yeah,
well as and you know
yeah. Thank you so much, Dr.
thank you.
Akshay.